feel like we're a little bit crooked, but that's okay.
Are we?
Maybe. It's an illusion. It's an artistic decision. Hello.
It's like one of those marketing tricks when they do something weird.
So
People
terrible.
look at the camera.
All right, 5-minute chat.
We're talking about why learning how to take a really good diaphragmatic breath, sometimes called lateral costal breath, sometimes called core breath, is very important during pregnancy.
Yeah.
Do you want me to start?
Yeah, go on.
So, number one, I think, is that ribs change very early in pregnancy. And so even before your uterus starts to actually change in size, your ribs actually open up like this and they move forward. And so that's to create, the diaphragm kind of flattens out to create room for the uterus to grow.
What's the diaphragm, Erin?
The diaphragm is your big breathing muscle that's like a giant umbrella that sits right underneath your ribs and it runs front to back. So it's like a dome.
Like
It
an
should be like a
umbrella.
dome. Yeah.
Yeah.
And so when you breathe, when you inhale, the diaphragm pulls down to pull air into your lungs, and when you breathe out, it recoils and pushes the air out.
Yes.
What's really cool is that your diaphragm and your pelvic floor, I always tell my patients, are BFFs. BFF. They like to work together. And so sometimes when you're having trouble with pelvic floor issues, the diaphragm can be really important or integral to them resolving. So during pregnancy, when those rib changes start, sometimes it's really hard to take a deep breath, and people will say, I feel really short of breath. My clothes aren't fitting the same, but because the diaphragm flattens out, you have to work harder sometimes to get it to do that downward movement.
And then later on, there's a physical human
Pushing it up.
impeding your ability to move that breathing muscle. So yeah, pregnancy, I think, has some interesting effects on the breathing muscle. The other thing, I think it's very trendy to see on social media right now, people talking about all this breathing stuff.
Yeah.
Do this breathing stuff. It's, I think there needs to be more intention behind it.
Yeah.
Like, breathing is not the be-all, end-all,
No.
but it's useful information to understand.
Yes, and people are like, do I have to breathe like that all the time? And I say, absolutely not, but it should be accessible to you.
Yeah.
So it's kind of like, I don't bend my arm like this all day, but I have the ability to do that. And so your ribs move in 3 directions in order to move the diaphragm down. And most of us are really good at apical breathing, so up down. Yeah. We're good at taking those breaths. And because of yoga and awareness of yoga, a lot of people are really good at taking what are called belly breaths.
Mm-hmm.
And so they'll really be good at expanding their belly, which sometimes is a bit of diaphragm breath too. What we're not so good at sometimes, I think just because of lifestyle factors and sitting and, you know, we don't move into extension a lot, is that we're not so good at opening our ribs this way, like bucket handles. And that's what we're really trying to do when we do a lateral costal or a diaphragmatic breath.
And especially because there's a baby here. So it's hard to do a belly breath.
Yes.
Even though it might be what you're more familiar with,
Good
you
point.
run out of space
Yeah.
when there's a human there. And even after birth, I don't love to give belly breathing because I already feel like, well, there's some abdominal separation. The tissue is really lax and flexible then. I don't know if I want someone breathing into their belly. I always go back to, like, I call it wide or rib breathing is what I call it.
Yeah.
How do you teach it?
I teach bucket handle, I say.
Yeah.
So I think there's a couple ways you can teach it. Sometimes if people are stiff, you actually need to work on some mobility first, and I have some videos on that too that we can link to. But working on mobility sometimes can really be helpful because then you can get that actual kind of movement back. But one of the best ways I find is to put some manual resistance. So either use your hands or take a TheraBand and wrap it around your back. And sometimes even just like laying on your belly.
Yeah.
Because it will stop the belly movement, so you can kind of force the movement into the side ribs a little bit more. And I find once people get that feeling, it helps. It helps.
I struggle because I'm very much an apical breather. Like, I'm very chesty breather. So I always tell my patients, take your normal breath. So I take like a Katie breath, and then I empty everything out of my lungs.
Yep. Push down.
And then I try to push my hands.
Perfect.
So I try to widen, but I'm like aggressive, I guess. I need like something to fight against in order for me to feel that lower rib expansion. But I find that does the trick for a lot of the time.
That's
but
a really
just
good point. Because if you're not fully emptied, it's going to be tough to get the opening, right?
Yeah, there's no place to go.
You have to take that exhale in order to be able to feel kind of that expansion happening.
Some people lie on their side and do it into like the table or into their bed. But yeah, so you're looking to make sure that your lower ribs are widening when you inhale. And what we should see happening in a nice healthy pelvic floor is that we get a reciprocal kind of lowering of the pelvic floor. And then on exhale, a little bit of a lifting. So you'll see people pair pelvic floor exercises with that. But we can talk about that at a later time.
5 minutes.
Bye-bye.